The idea here is taking your body's own immune cells, training them or modifying them so that they recognize cancer cells, and then unleashing them and letting them destroy the tumors or the cancer cells that are circulating in your body.
So is that the discovery, that they've learned how to train those cells?
Well, not a new idea, but this may be the most successful application of the concept. So we're not in a position now where this is going to be the standard of care, but it's interesting that after a year of treatment, or a year after the treatment, 2 of the 3 patients that were studied still were in remission, had no evidence of cancer activity. So that's a hopeful sign. And then the other piece that's really interesting here is that those immune cells that were modified to attack the cancer cells also developed a memory, what we call sort of memory cells. So the researchers believe that if the cancer were to come back, those memory cells would be on top of them and hopefully, again, fight them and destroy them.
Bonus.
Yeah.
Yeah, no, I saw here the researchers were calculating that every one of these engineered T cells was able to kill 1,000 cancer cells, which of course sounds amazing, but how hopeful should people be by these results?
Right. Well, yeah, this is what you might call a proof of concept. So this is an idea that's been worked on for some time. This is sort of a breakthrough in the sense that now we have some tangible evidence that this can work. 3 patients is really a small number. And so in the development of any new treatment, you have to start with small numbers, prove that it's safe, first of all, that it's not going to cause more harm than good, and second, that it's effective. We can say that it's effective in this small sample, but we need larger numbers to say that it's something that should be recommended for everybody.
Now, they are suggesting, or who is suggesting, that this might be a treatment that could be adapted to perhaps treat other forms of cancer, something beyond leukemia.
That's right. They've mentioned ovarian cancer, they've mentioned lung cancer, and other types of blood cancers as possible targets for this. This is really kind of a glimpse at the future. If you can take the body's own sort of fighting force, train it to fight certain things, like cancer in this case, you will hopefully reduce the chances of having side effects. And in this case, there were some side effects. Those killer cells were not perfect. They did actually kill some of the healthy cells as well. But the treatment seemed to be tolerated well by the 3 subjects.
Well, and I would suppose that would be one of the biggest issues, of course, with cancer treatment, is so often the treatments are just so debilitating. You know, people going through radiation and chemotherapy, you know, it's very, very difficult.
Absolutely. But on the other hand, we don't want to end up doing more harm than good. So when you're genetically modifying immune cells, what you don't want is for them to start to grow out of control and then cause their own types of problems. So, you know, again, these are early days. This is hopeful, and maybe, you know, years down the road we'll say that this was the first step.